नर्वस सिस्टम अच्छा इंग्लिश में मैं बात करूँगा ठीक है कोई प्रॉब्लम हो तो बताएं अच्छा सेंट्रल नर्वस सिस्टम मास्टर पास पेपर 2 अच्छा question number 1 OPG shows multiple well-defined unilocular and multilocular light legends were visible. These involve the body and angle of the mandible and were associated with uninterrupted molar. What is the most likely diagnosis? Corneal disease. Multiple degenerative. ठीक है now look at this figure. The keratoconus dysplasia. Okay, corneal disease is this. There's calcification of the phalanx, and there are multiple dendritic cysts. These are features of corneal disease. Let me please see. Corneal disease are multiple dendritic cysts, and there's calcification of the phalanx. So in this MCQ, they were just saying on OPG, you see multiple cysts in the mandible, who is most likely diagnosed with corneal disease. Another thing is that in keratoconus dysplasia, we see supernumerary teeth and obtuse angle mandible, and in Gardner syndrome, we see multiple conjunctival masses in the mandible. There is multiple osteomas with polyps in the large and small bowel, so it is Gardner syndrome. With MCQ, multiple well-defined unilocular, multilocular lesions were visible in the mandible, body angle mandible, and associated with uninterrupted molar. So there are multiple dendritic cysts are seen in corneal disease. Question number 2. OPG shows generalized expansion of the mandible and the ground glass appearance to the bone and multiple multiloculated cystic lesions affecting the both bodies of the mandible. What is the likely diagnosis? Cherubism. So this is a cherubism. Cherub is this angel, baby angel. So look at his cheeks; it is widened, and also if you look at the actually it always looks something like this. It's multiple expansion mandible with bilateral fibrous dysplasia, and then it looks like multiple cystic lesions in both mandibles. So it's cherubism. No other disease has such a presentation. Question number 3. Imaging right optic nerve appeared thickened with linear plaque-like calcification and optic canal hyperostosis. What pattern of enhancement is most likely? Generalized tram-track enhancement. Now, this is saying about the optic nerve meningioma that right optic nerve appeared thickened with plaque-like calcification and optic canal hyperostosis. So, what pattern of enhancement is most likely? Tram-track. In contrast to this, in optic nerve glioma, there is kinking and buckling of the optic nerve and its rounded lesion. Question number 4. This is also image of optic nerve glioma, optic nerve meningioma, tram-track calcification, optic nerve meningioma, tram-track calcification. And this is papillary edema. Okay, leave this. Optic nerve meningioma, tram-track calcification, optic nerve glioma. Question number 4. This scan shows gross bony destruction of the right greater ring of sphenoid, with softly revealing the superior figure. What nerves may be affected? 3, 4, 5, 6, and 6. All are eye nerves. Remember this mnemonic that superior figure, all the eye nerves 3, 4, 5, and 6 are affected by superior orbital figure destruction. But here also is 3, 4, 5, and up to the nerve 6. All these are the nerves involved in eye movements. Now, question number 5. Upper right side quadrantopia. Where is she likely to have a new plaque or lesion? Left optic radiation. Okay, now, when upper right side quadrantopia. So, when optic radiation is damaged, then the patient has most likely a right side quadrantopia. So, homonymous synopsia or quadrantopia. Same thing. You don't need to learn every detail of these lesions, but remember the common ones. Optic chiasm lesion causes bitemporal hymenopsia. Complete optic nerve causes blindness in the eye, and optic radiation is damaged, so homonymous hymenopsia. So upper right side quadrantopia, so left optic radiation is most likely damaged. Now this is the Mayer's loop, but this will be concerned with ophthalmology students, the every detail of the optic tract. Optic radiation is enough for us. Next, question number 6. 5-year-old boy CT shows poorly enhancing mass causing irregularity of the orbit and surrounding coronal fat haziness. This model is most likely to be secondary from which tumor? Neuroblastoma. Okay, neuroblastoma. This is eosinophilic granuloma. Remember, we have done this before, and this is neuroblastoma. But this is neuroblastoma mets to the skull, and here they are talking about the neuroblastoma in the orbit. So 5-year-old boy is poorly enhanced, but it looks something like this. In neuroblastoma mets to the skull. This is also olfactory neuroblastoma, but now we are talking about orbital neuroblastoma. So, poorly enhancing mass causing irregularity of the orbit and starting colon fat haziness. This might most likely to have been secondary from neuroblastoma in child, lung mets in children, and in lung mets is Wilms tumor, and eye mets will be neuroblastoma. When MCQ comes in child metastasis to the lung, most common is Wilms tumor, and in child metastasis to eye, most common is orbit metastasis, most common is neuroblastoma. Question number 7. Also, Wilms tumor, neuroblastoma differences. Question number 7. A 25-year-old male was admitted with a painful parallel right Horner syndrome. A contrast sheet was performed. In which area of the scan would you expect to find the pathology? Right carotid artery. Okay, this was what is this? IBS tumor. Okay, forget this. So this when a child has a painful right Horner syndrome, a contrast sheet was performed. Which area of the scan would you expect to find the pathology in right carotid artery? Because right side Horner syndrome is caused by external component by right carotid artery. The others, no option makes any sense. Let's see question number 7. The painful part of right side Horner syndrome is due to disruption of the sympathetic nerves in the wall of the ipsilateral carotid artery caused by dissection. And look at the big MCQ. A 25-year-old man admitted with painful partial right Horner syndrome. So when there's right side Horner syndrome, then there will be uh, due to pathology in right carotid artery. It cannot be in left carotid artery because the side which has Horner syndrome, there will be the pathology. So it also cannot be in other options, don't make any sense. Okay? Question number 8. CT scan of the parallel sciences. The right frontal size appeared significantly larger than the left when opacified. At the base there was a dense lesion which appeared to contain compact cortical bone and protruded into the sinus cavity. MRI, the lesion appeared as a single void, where the most likely diagnosis ivory osteoma. The frontal ivory osteoma. So it's explained here that CT scan of the parallel sinuses. The right frontal sinus appeared significantly larger than the left, was opacified. At the base there was a dense lesion which appeared to contain compact cortical bone and protruded into the sinus cavity. MRI, the lesion appeared as a single void. That is the CT scan, there's no MRI. MRI, the lesion appeared as a single void. Diagnosis क्या है? Frontal bone ivory osteoma or frontal bone ivory osteoma. Next question number 9. Newborn boy, baby boy, CT scan showed bilateral air fluid levels within the nasal cavities and narrowing of the posterior coronae with bowing of the posterior maxilla. What is the most likely diagnosis? Bilateral coronal atresia. Okay. Image of perennial coronal atresia. Now look, this is normal CT scan of the perennial sinuses. Can you see clearly ethmoid ear cells and posterior normal PNS view. Normal PNS view. ठीक है? So normal open. Now this is bilateral coronal atresia. If you look in this, compared to normal, the posterior part of the nasal cavity is shrunken. So CT scan shows bilateral air fluid levels within nasal cavities and narrowing of the posterior QNA. Over here is also very narrow, posterior QNA, with bowing of the posterior maxilla. The posterior maxilla is also bowing. What is most likely diagnosed? Bilateral choanal atresia. Compare this with this normal CT scan. This is normal. Okay, now next question number 10. Pulsal tinnitus. Otoscopy shows blue mass deep to tympanic membrane. CT scan shows small left-sided soft tissue mass abutting the left cochlear promontory. This enhanced brightly with contrast. What is the most likely diagnosis? Glomus tympanicum. Now, what I don't like in the ear is that all these pathologies are very small and you have to look closely. With glomus tympanicum, which one is glomus tympanicum? So this is mass deep to the tympanic membrane. So this is glomus tympanicum, correct? Okay, now look right here. This is glomus jugular. It is inside the jugular fossa of the mass, correct? Then this is epidermoid cyst. This is the granuloma. Okay, so this is glomus jugular. This is jugular forma. You go here. This is glomus tympanicum. And this is glomus jugular. This is glomus tympanicum, and this is also glomus tympanicum. The mass in here will be glomus jugular, like this glomus jugular. Okay? So this is sides choroid parotid tumor. When in front MCQ comes of choroid parotid tumor, you will see it. Now, in this, the hints in the MCQ is that there will be blue with tympanic membrane mass, or in a jugular fossa if it is, then in jugular glomus jugular. Glomus jugular inside jugular fossa, mass inside jugular fossa, glomus jugular, and mass deep to the abutting the left cochlear promontory, so it is the glomus tympanicum. Question number 11. Facial nerve. Which structure lies medial to the nerve can be used as a landmark? Retromandibular vein. Okay? This is the facial nerve, and this is retromandibular vein. So it is used as a landmark when doing surgeries with the parotid gland. ठीक है ना? English सही है ना? जी?
Yes, sir. It's okay.
ठीक है.
All images are bad.
अच्छा.
And excellent presentation.
ठीक. Question number 12. 2-year-old boy has discharging mass on the bridge of the nose. A microcystic lesion, which was of heterogeneous increased signal on T1W and T2W. The density of the lesion on CT was that of fat. What is most likely diagnosed? Dermatitis. When an MCQ comes, density is that of fat, then dermatitis. Right. Acha. Then there's features. It says that lesion was heterogeneous and increased signal on T1 and T2. So fat is also high signal on T1 and on T2. And on CT, density was fat, so dermatitis. Direct by these findings. And this is inverted papilloma. Okay, this is the next one. Question number 13. Gradually worsening nasal obstruction. And the scope shows polypoidal mass filling the left nasal cavity. CT scan shows a soft tissue mass arising from the lateral nasal wall with associated bone destruction of the medial wall of the maxillary sinus and heterogeneous enhancement of post-administration of contrast. What is most likely diagnosis? Inverted papilloma, polypoidal mass. Remember that this is inverted papilloma. It's P-shaped. P-shape. You should be able to make a P-shape from it. So it's inverted papilloma, right? This is angiofibroma. We read this yesterday. Strong enhancing lesion due to vascularity. Now the frenulum carcinoma causes destruction of bones. And this is the vascularity of most likely angiofibroma. Now let's read the MCQ again. Endoscopy shows a polypoidal mass filling the left nasal cavity. CT scan shows a soft tissue mass arising from the lateral nasal wall with associated bone destruction of the medial wall of the